Hi, my name is Paul Kravczynski. I'm the Operations Manager at OnePassport. The OnePassport suite of products was developed over 3 years ago and has been tried and tested in many organizations. OnePassport Comply was specifically developed to assist organizations in meeting their workforce compliance, ensuring that staff had all their I's dotted and T's crossed. When Comply is combined with the OnePassport Profile app, it creates a powerful system where your staff are able to upload, share, and manage all their information with various departments. Our immunization passport, which is free to use within the app, makes it simple to manage, monitor and report on staff and visitor related immunizations, including COVID-19 test results. With all these tools available, ready to use and extremely affordable for organizations, we are really surprised that we face another outbreak within the aged care sector. I reached out to Amanda Edwards, who is our Executive Director in Aged Care and Healthcare, who herself is in lockdown at her home in Ballarat. Amanda joined OnePassport because she knows firsthand the damage and pain to both organizations and people that a breach of compliance brings. Amanda, as a first-line nurse yourself, could you please explain to the viewers what occurred in the aged care homes in Melbourne and how the suite of OnePassport products could have prevented this?
Well, Paul, sadly, Victorian aged care homes are once again subject to a COVID outbreak within their community and have been locked down to protect the residents. I think residents and their families are quite rightly asking, how can this happen again? Weren't the residents and the staff the first people to get vaccinated? Because that's what we heard at the beginning of the rollout. Aged care homes come under the jurisdiction of the federal government. Each home received 1 to 2 visits to vaccinate the residents who wish to be vaccinated. It's not mandatory, so not all residents consented to vaccination. Whatever was left on the day was given to staff. However, what's really interesting is that no formal arrangements were actually made for the staff, who come and go from the facility every day and much more likely to come into contact with COVID. On the whole, it appears that they were left to pretty much fend for themselves and arrange their own vaccinations, with the exception of a couple of larger providers who tended for the ability to administer vaccines to their staff. Pfizer is actually a better vaccine for frontline workers, as there's only a 2-week gap between the first and the second dose, whereas AstraZeneca has a 12-week gap. And that's what we've heard with the residents, that they're now getting their second dose. At a vaccine centre, you essentially get whatever they have on offer. And AstraZeneca was actually more available in a lot of these centres. So that means that staff that did go and get vaccinated often got the AstraZeneca, which has a 12-week gap. The second issue is that while data is being uploaded onto the government website, the ability to draw out data and run reports is not available at this time. Many homes are still using spreadsheets to collect data, if they're collecting it at all. And even the Minister of Health is unable to tell us how many aged care staff have been vaccinated. What this means is that they're not necessarily clear themselves on which staff have or have not been vaccinated. And that's a real problem. With OnePassport Immunise, this data would have been at the fingertips of every home, even broken down into the number of nurses, carers, food services, staff, and others coming and going from the facility. The third issue is that some staff work in more than one home. Now, it's too simplistic to say that people can only work in one home. Doctors might have residents in several homes. Physios, podiatrists, dietitians, and other allied health usually work at more than one home. So if residents are actually to get the best care, then people are still going to need to continue to do this. If they had OnePassport though, these staff would be able to present evidence of vaccination and test results prior to entry to minimise the risk of transmission. And that's not happening now. OnePassport Immunise is an immunisation register where staff can upload the record of their COVID or flu vaccination or even their test results and share it with their organisation or organisations. This means that the home is quickly and easily able to run reports that show them exactly where they've got gaps And so they can follow up with these staff and ensure that as many staff as possible are vaccinated in the shortest amount of time.
How quickly could OnePassport enter an organisation and establish their compliance products to help organisations prevent this occurring again?
We can move really quickly to implement the OnePassport system in their homes. For example, last week, prior to lockdown, we implemented the system at Bairnsdale Regional Health Service. I went on site and trained staff, and we connected over 100 staff just in that one day. The implementation has been 4 weeks from sign up to commencement with actually no pressure applied. They're quite a large organisation, so that's pretty good. Under pressure, we can actually implement within 2 weeks in most organisations.
Have any organisations that operate the OnePassport Comply product experienced a breakdown in compliance?
None of our clients have had a breakdown of compliance. It's actually almost impossible to do that when you're using the OnePassport system. It's got alerts and notifications that are going to keep you on top of all of that stuff. So it's really frustrating for me to see us still struggling with these very, very basic activities that can help compliance. I know we've got a great product. I know we can help health services, aged care services, disability services, community organisations. They've just got to get in touch with us and let's get it done.
Thank you, Amanda. To find out more about how OnePassport can help your organisation manage their compliance and immunisation data, you can reach us on sales@onepassport.co or any of our OnePassport social media links. And remember, the app is free to download for individuals. You can keep Australia open by following these 3 steps within our immunisation register: jab, click, share. Thank you.